we are going to talk about the birth plan. So what is a birth plan? It is a record of what you may like to happen during your labor and after the birth of the baby. Your birth plan is personal to you. It depends on what you want, your medical history, your circumstances, and what is available at your maternity service. What may be safe and practical for one pregnant woman may not be a good idea for another. Before we go ahead to understand the elements of a birth plan, we must know that it is not essential for everybody to have a birth plan. So please do not stress out if you haven't made one or if you don't wish to. It is a choice and just a record of your preferences that you may have. But yes, if you want to, your maternity team will help you. Secondly, labor is full of surprises and does not always go as planned. Hence, please be flexible and be prepared to do things differently in case any complications arise with you or your baby. So what all is there to plan and what are the elements of a birth plan? So number 1, choose your birth companion. This is the person who will be allowed inside your labor room throughout your labor and delivery process. This could be anybody, your partner, husband, mother, sister or friend, whoever you are most comfortable with, who can motivate you and encourage you to keep going and tell you that it will be all worth at the end. Secondly, there are some routine procedures that are carried out once you enter the labor room. For example, part preparation and enema. In the birth plan, you may specify any preference that you may have regarding this. For example, are you okay with shaving the hair from your private part, which is the norm, or you would like clipping, or you do not want any? Sometimes enema is given when your bowel is too full. You may document your feeling about the same too. Also, how would you like to hydrate yourself? Are you okay with a lot of oral fluids or you would like intravenous fluids? Next, in the birth plan, we will document about the pain relief methods. There are a lot of options available. For example, breathing and relaxation techniques, massages, being in water, pain relieving injections, gas and air, Antonox and epidural analgesia. You should discuss with your healthcare providers about the options available at your maternity service and opt accordingly. Next is skin to skin contact desired or not. Skin to skin contact means that as soon as the baby is born, the baby is put directly on the tummy of the mother even before the umbilical cord is cut. This has a calming effect on the baby and it boosts mother's milk supply. However, some women prefer that the baby is cleaned first before being brought to her. You may specify your preference about the same. Next, cord blood banking. This is something you should have discussed with your obstetrician in the 3rd trimester, especially if anybody in your family is suffering from a major illness or a genetic issue. This is a completely optional procedure, but yes, if you decide to do it, do let your maternity team know so that they can do the needful. Next is your preference about breastfeeding. Breast milk is undoubtedly the best form of nutrition your baby can have. This provides the baby with all the nutrients, promotes the emotional bond between the mother and the baby, and has long-lasting effects on the health of the baby. However, infant formula milk is an alternative. You may decide to completely breastfeed your baby, or you can go for infant formula milk, or you can try a mix of both. In case you are not sure at this point, you may let your team know and figure it out later. Next is vitamin K to the baby. Vitamin K is required to help the blood clot properly in the body. Some babies are born with low vitamin K. In that case, your neonatologist may ask for a vitamin K injection to the baby. You may give the consent for the same now or later. Next are some routine vaccinations which are given in the hospital. After the birth of the baby, in the first 24 hours, there are some vaccines like BCG, oral polio vaccine, and hepatitis B vaccine, which are usually administered in the first 24 hours. You may discuss these with your neonatologist and decide about them now or later. Apart from these things, in your birth plan, you may document any special requirements that you may have. For example, any dietary preference, need of an interpreter, or even any religious customs. Once they are documented in the birth plan, everybody is on the same page and these can be followed. So apart from these things, there are some things which are done which are not exactly choices, but they are essential. But it is, however, good to know about them and document your feeling regarding the same. For example, an episiotomy. An episiotomy is a cut which is given between the vagina and the anus during the delivery of the baby when the perineum won't stretch enough and we fear that there might be a bad tear. It is given only if absolutely essential. Second, delayed cord clamping. This is something which we practice routinely, which means that the cord is not immediately cut after the delivery of the baby, but an extra 1 minute is given for extra blood to pass from the mother to the baby. Lastly, a delivery of the placenta and membranes. After the delivery of the baby, an injection is offered to be given in your thigh which contains a drug called as synthometrin or syntocinon, which helps the uterus to contract and prevent excessive bleeding which can happen once this injection is not given. Finally, remember, this is just a plan, and even if it does not go exactly as planned, it would be a great positive experience. Thank you.